I'm going to call to order this meeting of the Monroe County Board of Commissioners. It's April 14th, 2021, and I'll begin with our statement. We, the Monroe County Board of Commissioners, renew our commitment to welcome and protect the rights of all people, regardless of age, race, color, creed, disability, sexual orientation, gender identity, marital status, economic status, and national origin. And we affirm the right of every person to live peacefully and without fear, and we will fight and resist at every step discrimination and harmful policies, whatever their source. We also stand in support of our public school systems, both RBB and MCCSC. All right, and with that, we have an agenda revision.
Yes, I'd like to make a motion to strike item D, INDOT mitigation properties.
Second.
We have a motion and a second. We're going to go ahead and move that to our work session agenda, correct?
Yes, yep.
Great. Comments, questions? All right, seeing none. Mr. Copper, will you please call the roll on moving item D to the work session?
Commissioner Thomas.
Yes.
Commissioner Jones.
Yes.
Commissioner Githens.
Yes.
Motion is approved 3-0.
Great. And I forgot to note for the record that the entire Board of Commissioners is present for this meeting. But we are all here. We just voted. All right. So with that, we will move on to department updates. And we will begin with the Health Department, Ms. Caudle. Good morning.
Good morning. Thank you for allowing me to be here again this week. I will start with what I think is probably on most people's minds, and that's the Johnson & Johnson vaccine and the current pause for using it in our vaccination clinics. So two things that I want to stress. So out of almost 7 million doses of vaccine, there have been 6 cases of reported cases of a rare severe blood clot in people receiving the J&J vaccine. It does, at this point, we don't know that it has anything actually to do with the J&J vaccine. Out of almost 7 million doses of vaccine, 6 cases is a very small amount. Of those 6, there was 1 death, but it is worth investigating, and this is really showing us that the system works. We have the system for reporting adverse reactions to vaccines, the VAERS program, and that's how these were identified. So that really shows us that the system for that does work. So there's a pause. The CDC is convening a group today to review those cases and make an assessment on what the next steps need to be. And so we'll be awaiting that. That may take a few days or so. I don't know what the exact timeline on that will be. And I'm sure some of it will be on the exact information that they have. But in the meantime, Indiana, along with all the other states, have paused use of Johnson & Johnson. I will say that these 6 cases have been in women between the ages of 18 and 48, and the symptoms have occurred 16 to 13 days after vaccination. So that's important to know as well. But you know, there's no reason to do anything but remain calm if you've received Johnson & Johnson. But if you have received it recently, just watch for those pain in your legs, shortness of breath, the symptoms that might come along with that. Alerts have went out to physicians so that they know what to look for. They know this is different from some of the routine blood clots that we might think about. So treatment is a little different. So that information has been sent to providers across the state and across the nation. So we'll learn more about that as we go through, and information about that is certainly posted. The next thing that I want to talk about is just kind of a general overview with vaccines. On a good note, more than 1.4 million Hoosiers have been fully vaccinated. That is good. There are over 650 vaccination sites, and those sites that were using Johnson & Johnson are switching to Moderna. You probably have heard that the Motor Speedway clinic, they still are running that right now with Moderna. The trick with making that switch is Moderna requires a second vaccination about a month later. And so they have to figure out where that's going to happen and how that's going to work, because the Speedway won't be available in May. And so they're working on that, and we'll make sure that we share that information as they get that out as well. So in terms of Monroe County, we have nearly 30,000 people fully vaccinated. Over 48,000 people have received their first dose of vaccine. So very pleased about that. That's about 23% fully vaccinated. And with a population of about 128,000 people who are eligible, we know that we have a large portion of our population that is younger, not yet eligible, or has just become eligible for vaccine. So as that has changed, we anticipate that that percentage of fully vaccinated people will go up as well. So that we're good in terms of vaccine. We're making the adjustments that we need to make. We did add a clinic at the convention center for today. And once those appointments were open, they filled very, very rapidly. You may have heard that Pfizer has put in for emergency use authorization for ages 12 to 15, and we are expecting by early May to have an answer about that. So we are also looking at how we can make vaccine accessible to those younger residents as well. When we look at what's going on with the virus, variants continue to be a concern. Over 356 cases have now been identified in Indiana. And again, we've talked about this before, not every specimen is tested. It's just sort of a process. So these are all minimum numbers. We've also seen the variant, the South African B1351 variant in Indiana, as well as the Brazil variant. Florida and Michigan are still leading the way with a number of variants as well. And we've seen the California variant. That's actually the variant that we're seeing second to the UK. So with that, we talk about the metrics every week. And some people may have missed all of this, but we've been talking about how we make decisions for the last year or more. And it isn't any one piece of information, it's a variety of pieces of information. So while our positivity rate may remain low, it is rising, so that's a concern. Our cases per 100,000 this week should be around 135, which is a moderately high level of community spread. So it is concerning. Last week, it was about 138. So I am hoping that we're starting to see a leveling off, but we will have to watch the data and see how that comes in over the next few weeks. We have been in yellow now for over a week, couple weeks now, and you are going to see on that metrics map today that much of Indiana is going to be yellow. So we know, if you've watched the news, you know that there is an increase in cases. Our hospitals are seeing an increase in their census for COVID as well. So all of these things are concerning, and we continue to watch them very closely, and we'll make decisions based on the science and the data, not on feelings or thoughts about it, but on the actual science of that. So watch for those color-coded maps. The dashboard does change. There's new information on the vaccine dashboard. So I'd encourage people to watch that to get up-to-date information about both vaccine and viral spread. And that's what I have for you.
Great, thank you for all that information. Comments, questions, Commissioner Jones?
Yeah, is the pause in the Johnson & Johnson vaccine going to affect any of the appointments that have been currently made?
No, it's certainly not here in Monroe County. We did have people scheduled for Johnson & Johnson. As you know, we don't have a lot of that. We've used some of that for some of our smaller outreaches, and we have notified them that they would be getting Moderna. It will mean that we have to do second visits. So it will slow things down, because now where you might be able to schedule lots of clinics going forward, now you have to work in those second dose appointments into that schedule. So it may slow some things down, but no, for us, it isn't. At the state, they are actively switching out, making sure that places have the Moderna to replace any of the Johnson & Johnson that people had. So hopefully it won't, certainly in the short term. If this lasts very long, then it certainly may. So people should kind of pay attention to where they're getting their vaccine. It's quite possible that what they're getting will change. If any appointments are actually canceled or changed, people should get an alert through that vaccination appointment through the scheduling system.
Thank you.
Thank you. Commissioner Giffens? You're on mute.
Sorry, I've got background noise here. It's a reminder to all of us that we still need to mask up and socially distance and do all the things that we were doing. And it's harder because we want to be out. It's beautiful weather, and yeah.
Good point.
What we were doing before worked.
Yes.
It did. Well, for the most part. Yep, and we appreciate all of the information. I know this is an evolving story, but I think it's important to not let this dissuade anybody from getting the vaccine, because of it is overall very safe. And I heard an interview with a physician who said that these blood clots are actually more common in the general population than they are with the Johnson & Johnson vaccine. So there's that you're right, it indicates an abundance of caution, and it's really, a smart thing, and it shouldn't scare anybody off. This is a good way to proceed, and we appreciate all of the guidance from our local health department, the board, and of course Dr. Sharp. So thank you for everything you're doing and continuing to do this nonstop pandemic that we seem to be in. So let's try to get out of this as quick as we can by doing what we need to do to stay safe, as Commissioner Giffens said. So thank you.
Thanks.
All right, let's turn now to Ms. Allison Moore, Emergency Management. Good morning.
Good morning. Thanks for having me. I have just a couple quick announcements. I know that I have announced the last couple weeks that we are in need of filling those blood drives that we have scheduled for April. We are still in major need of getting our individuals in our community to sign up for those spots. You can do so at the redcross.org website. And because those April spots aren't filling up like the normal months have been in the past, if you are an individual ages 16 to 24, then they are giving out e-gift cards for places in our community to eat. So it's a good way that the Red Cross is working with those individuals that are younger and oftentimes healthy, that can make those donations. And oftentimes it works well for the Red Cross, because once you've begun making those donations, you see the impact that it has. And a lot of times they return again. So it doesn't necessarily have to mean it's for a first time use. Oftentimes, if you're in that age group, it would be a first time donation. And then hopefully they could start that cycle. So it would hopefully be a win-win for everyone. And I am excited that the Red Cross is working with that age group. So again, if you're 16 to 24 and you can make an appointment on either one of our April 29th or 30th blood drives, you can go to the redcross.org website. And then when you arrive that day for your appointment, you will get an electronic gift card within a $10 value. It is about halfway through April and we are in flooding preparedness this month. And so my statement I want to make is, if you have flooding in your home or around your home, it is suggested that you mark the height of the water. Oftentimes when the water recedes and then it's time for FEMA reimbursement, we can't measure the height of the water, and that is something that is an indicator on if you would qualify for FEMA reimbursement. It's oftentimes something that people don't know they need to do. So just to make note, if for some reason you do have flooding in or around your home or outside structures, it's good for you to measure a line. And of course, always take pictures of that so you have the documentation needed when we file that FEMA report. So that's my helpful hint for flooding this week. You can also sign up for our Monroe County alerts at our county website. It's on the megaphone on the homepage at co.monroe.in.us. It seems every week we continue to get more people signed up for that website. And so it's definitely the thing to do. And we encourage any individual in our community that has not signed up to be able to get those weather-related events, health-related notices, and such. And that is all I have. I'll take questions.
Great. Thank you so much, Ms. Moore. Comments, questions, Commissioner Jones?
No, I don't.
Commissioner Githens?
No, sorry, I can't give blood this month. It hasn't been enough of a gap yet for me, so.
It's okay.
Yeah, thank you for all the information, and hopefully we won't have any flooding to contend with, but it's good to remember that little tidbit of information. It's really important. So thank you for that.
Sure.
All right, and with that, we will turn to Ms. Ridge, Public Works. Good morning.
Good morning. Good morning. Not much to report, except that we did start the paving for the community crossing paving projects that was awarded last fall. Those roads being Corey Lane from 2nd Street to 3rd Street, Anderson Road from Low Gap Road to Bean Blossom Road, Old State Road 37 North from Chambers Pike to Anderson Road, and then also Ratliff Road will be Loudon Road to Hart Strait Road. So we do have, they did start Corey Lane on Monday, and then they'll move to the other locations. So just use caution in those. They'll have flaggers in place, and looking forward to those finished paving projects.
Great. Thank you so much. Comments, questions, Commissioner Jones?
No, I don't.
Commissioner Githens?
No, thank you.
Can you remind folks once again how to report a pothole or any road damage?
Sure. Any type of hazard or road request, repairs, any type of request that you would have for the highway department or stormwater division can be reported. You can call 812-825-5355, or you can go to the county website at co.monroe.in.us and hit on the highway page, and you can report any type of work request on our website.
Great, excellent. Thank you so much. I know the crews have been out and been active, so we appreciate that. They can't be everywhere at once, but if they don't know about a pothole, they can't fix it. So be sure to let folks know.
Absolutely. It's, street sweeping requests, mowing requests. We do have started the mowers, so everybody is out in full force. So any type of request that somebody would need addressed, and we'll investigate it and get it into the system.
Great. Thank you so much. It's amazing that it's mowing season already.
I know. I think I've mowed like 4 times already.
Wow. That's impressive. All right. Thank you so much. Let's see if there are any other department heads who have an update to provide us. And I don't see any. All right. And with that, we will move on to public comment. Public comment is reserved time for residents who have comment on items that are not on our agenda. Public comment, just like comments after following the introduction of new agenda items, is limited to 3 minutes per person in each event. And we have a tone that you will hear. And when you hear that tone, that means you're at 2 minutes, 30 seconds. There's also a handy timer that will appear on the screen. So let's start with public comment. Again, for items not on our agenda, we'll begin with Mr. Shelton. Good morning.
Good morning, Commissioners. Jim Shelton with the Chamber. Want to remind everyone again that April is National Child Abuse Prevention Month. And then I want to let them know that there will be an event this Friday from 11 to 3. The Department of Child Services and CASA are jointly conducting an event in the DCS parking lot, which is at 1531 South Curry Pike. It's the same parking lot that Bureau of Motor Vehicles uses. There will be staff members from DCS, staff members from CASA, as well as some CASA volunteers there to provide information on dealing with child abuse in Monroe County. And then there'll also be activities for children. There'll be giveaways. There's going to be, I believe, 4 different food trucks there. So it should be a nice event. It'll be socially distanced. Everyone needs to be bringing their mask with them because everyone there will be wearing a mask. Of course, it'll be outdoors, so it should be very safe. So invite people to come and do that and learn what is being done on child abuse prevention in Monroe County. And then just as an order of magnitude, this is new information from a week ago. Sad to say, we're now serving 324 children with a CASA. It was 310 just the 1st of March. Well, I guess that's right. That's 6-week-old data. And we've now still got 133 CASAs working those cases. And we're now up to 41 cases, 41 children who are awaiting a volunteer to be their CASA. So to help get prepared for being a CASA, we have a training that will be in June, start June 7th through the 30th. CASA potential volunteers would learn the roles and responsibilities of CASAs, the child protection law provisions in Indiana, and then the family dynamics of abuse and neglect. So if this is something you think would be interesting to you, please call 333-2272 or go on monroecountycasa.org. Click on the volunteer link. You can find a frequently asked question page that'll provide a lot of info. The application to be a CASA can be downloaded or actually filled out online or downloaded and snail mailed in. The applications will be due a couple weeks before the training starts. So we really need volunteers to step forward. It's very satisfying. It's a good way to help the community. It feels really good when you help children either get reunited with their parents who've gotten their acts together or to help them get adopted into a forever home. So thank you for the opportunity to spread that word, and we hope we'll see some of you out on Friday. Thanks.
Great. Thank you, Mr. Shelton. Is there anyone else that wishes to offer public comment? Mr. Muchler.
Thank you. I'll just speak very briefly. I haven't been able to attend these meetings as regularly as I would have liked, so hopefully this has already been something that other people have spoken on and are thinking on. In the next few weeks, many shelters across Monroe County will close, putting an estimated another 100 people into spaces where they don't have a reliable bed. As you may have heard, the position of the mayor's office is that there's probably nowhere in the city of Bloomington for these people to legally sleep. It needs to be a community discussion, and that it's not one of the city's core values or core missions. And I look at the exact words there, to make sure that there's somewhere for people to legally sleep. On top of that, as we've sadly seen, the pace of police killings of all of our citizens, and especially young Black men, is continuing as we head into a new and uncertain phase of this pandemic, as earlier spoken, where there will be an all different set of challenges. What I would like to ask of the county is to do what the city has not done and accept that these are real challenges and even crises that we are going to face over the next few months, and to proactively look for a solution. Maybe it's not the best one, maybe it's not pleasing to everyone, but to engage with it to use the powers and authorities vested in this body to do something so that people know what they can do and that people aren't left out in the cold or the dark. Thank you.
Thank you, Mr. Muchler. We appreciate you joining us today. Let's see if there's anyone else that wishes to offer public comment for items not on our agenda. All right, seeing none, we will come back to our regular agenda for approval minutes.
Move approval of the minutes for April 7th, 2021.
Second.
We have a motion and a second. Any comments, revisions, edits?
No.
I sent just a Scrivener's error thing to Ms. Hill already, so.
All right, thank you. Mr. Cockrell, will you please call the roll on the approval of minutes for April 7th, 2021?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Githens.
Yes.
Motion is approved, 3-0.
All right, thank you. Next item, please.
Move approval of the claims docket, accounts payable, April 14th, 2021.
Second.
We have a motion and a second, and we have Mr. Miller here. Good morning.
Good morning. The total for claims was $6,058,433.38. $3,778,001.65 was for lit distribution for April. $788,266.06 of that was for public safety lit distribution specifically. $1,262,730 was for Monroe County Treasurer for full-time self-insurance. $282,436.73 was for wheel and surtax distribution for February. And finally, $133,788.50 was for Stone Belt Arc Inc. For the second quarter payment.
Great. Thank you so much, Mr. Miller. Comments, questions, Commissioner Jones?
No.
Commissioner Githens?
No, but I joined the meeting today so I could see the baby.
Maybe not this time. I think it's nap time, but I'm sorry. We'll see.
All right. Is there any public comment on this item? Just raise your hand at the bottom of the Zoom screen if you have public comment to offer. All right, seeing none, we will come back to the board for a vote. Mr. Cockrell, will you please call the roll on approval of claims docket accounts payable, April 14th, 2021?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Githens.
Yes.
Motion is approved, 3-0.
Thank you very much.
Thank you so much. All right, and with that, we will move on to new business, please.
Move to approve entity reimbursement grant for COVID-19 expenses. Fund name, County General, fund number 1000-36996-0069 in the amount of $64,723.75.
Second.
Sorry, we have a motion and we have a second. Ms. Gregory.
Good morning, commissioners. I'm back this week requesting reimbursement approval for the 17 completed community assistant grant applications received in March. As you stated, the total is $64,723.75. Yeah, as you know, we kind of discussed this in more detail last week, and I'm happy to answer any other questions you may have.
Great, thank you so much. And just a reminder to the public that these applications will continue to be accepted through the end of the month. So you only have a few more weeks to get your application in at co.monroe.in.us. Let's see if there are any comments or questions. Commissioner Jones?
I'm just glad that we're able to do this And I'd like to thank the auditor's office for all the time they put into it.
Commissioner Githens?
Yeah, I said many times, I'm so proud that we're making sure that we have a community that's going to be healthy and employed and housed as we come through this pandemic.
Yeah, absolutely. Yeah, it's a great program, and thanks to Ms. Owens as well for her assistance. And clearly, this is a lot of work to go through these receipts and to work with each of these entities to make sure that this fits the criteria that we've established. But it's something I'm really proud that Monroe County's done, providing not loans but grants to these businesses and social services and taxing units as well. So thank you for all of the hard work from everyone to make this happen. And thanks to the council as well for supporting this initiative, because we wouldn't happen without them either. So with that, let's see if there's any public comment on any of the items. Mr. Shelton.
Good morning again. On behalf of the Chamber, we want to thank you for the business community for this program. It has really been essential for a lot of our businesses, and we thank you so much. Hopefully you're right. This will have a more vibrant economy when this thing is gone than it would have been without this. So thank you, and thank you to the auditor's office and the council.
Excellent. Thank you so much, Mr. Shelton. We appreciate that. Any other public comment on this item? Just click on the raise hand button at the bottom of the screen. Okay. Seeing none, we'll come back for a vote. Mr. Cockrell, will you please call the roll on the entity reimbursement grant for COVID-19 expenses?
Commissioner Thomas?
Yes.
Commissioner Jones?
Yes.
Commissioner Githens?
Yes.
Motion is approved, 3-0.
Great. Thank you so much.
Thank you, commissioners.
All right. Let's move on to the next item, please.
Move to approve ratification of the Indiana Department of Health naloxone grant.
Second?
We have a motion and we have a second, and we're joined by Ms. Call again. Good morning.
Good morning. Kind of on to the more routine things, right? That we have received this naloxone grant since 2016. It is not money. It is actual naloxone for distribution in our community to help protect lives of people who may be overdosing, specifically from opioids. So we partner with other entities in the county, emergency responders, our fire departments, our police departments, Centerstone, Beacon, and the various shelters, Positive Link, Wheeler, Indiana Recovery Alliance, and others to help us distribute naloxone to people who may need and want to have it in case they come across someone who is overdosing, so that they can provide that life-saving care that they need. So we also give it to individuals. So, you know, if someone needs it, if they're concerned, we can do that training for them and dispense that directly. We do it through outreaches as well with our harm reduction specialist. So there are a variety of ways to get naloxone. The last few years, we have received anywhere from 1,000 to 1,500 doses. We anticipate this grant will supply us with about 1,200. But also Indiana Recovery Alliance gets naloxone from some other sources. So in our community in 2020, the state health department's reports, it was almost 20,000 doses of naloxone that had been distributed. So we're glad to get that out into people's hands. It is more difficult to know and get real hard numbers in terms of how much of that is used, right? Because not everyone who uses it is going to necessarily go to the hospital or report that use. It is asked that they report it when they use that, when they're given that, but not everybody is going to feel comfortable doing that. But it is life-saving medicine treatment for people who are experiencing an overdose. And we are glad to be able to share that with our community to reduce the number of deaths that we may experience from overdose.
All right, thank you so much, Ms. Caudle. Commissioner Jones, comments, questions?
Yeah, I just remember hearing about this rather frequently in the past, and it's pretty great that the state is making this available to us.
Yes.
Commissioner Githens?
Yes, I'm really pleased that we have this program. This is a county specific kind of setup that we have available. But also overdose deaths were up in 2020. And while nobody's sure why that's happened, there's some thought that it might be because people are more isolated and they don't have others around them who can administer a dose when they are in crisis. So I'm really happy that you're, reaching out and letting people know that you'll supply not only the naloxone, but the training for folks. Thank you.
Yeah, it's excellent, excellent points, Commissioner Githens. The opioid crisis has been sort of overshadowed by the pandemic, and we can't forget that that's still going on. So really, it also highlights the continued important work in other parts of our community for our health department. So we appreciate everything that you're doing. And let's see if there's any public comment on this item. Mr. Shelton.
Hi, I've got two hats on, so that's why I'm talking so much. I want to say this is a wonderful program on NACASA for a little a little guy that'll be 4 next week, who would have lost his mom if it were not for this program. She overdosed at Centerstone, and they quickly knew what to do. They had this, and they were able to save her life. This was just about 14 months ago, and since she has gotten her act together, she has controlled her addiction and is back in Indiana employed and about hopefully to be able to be reunited with her child. And none of that would have been possible without this. So it's a wonderful program. I'm so glad the state is doing this and that you guys are taking advantage of it. So thank you.
Thank you, Mr. Shelton. That's a good reminder of the real world implications. Any other public comment on this item? Okay, seeing none. Mr. Cockrell, will you please call the roll on the ratification of the Indiana Department of Health naloxone grant?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Githens.
Yes.
Motion is approved, 3-0.
Thank you.
Thank you. All right, move on to item C, please.
Move to approve Manager Plus Solutions LLC agreement, fund name Cumulative Capital, fund number 1138, in the amount of $1,009.65.
Second.
We have a motion and a second. Mr. Crone, our facilities fleet manager. Good morning.
Good morning, everyone. Thank you. And this is my first official commissioners meeting, I do believe, in all my years here at the county. So for those of you who out there who don't know me, my name's Greg Cron, facilities and fleet manager. So what I bring for you this morning is a request for approval for the expenditure of $1,009.65 from the Cumulative Capital Development Fund payable to Manager Plus Solutions LLC for the purpose of upgrading our current facilities and fleet manager software to their newest version, which is Manager Plus Lightning. The newer version offers increased user interface ability, cross-reporting, tracking, GPS tracking. There's many modules that go with it. So it's a much improved product over what we've been currently using with them. This is a prorated cost that reflects up through October 11th of this year when our contract expires. And that's what I have.
Great. Thank you so much. Comments, questions? Commissioner Jones?
Just that this is a program that should help make us considerably more efficient and should also save quite a bit of money. So thank you for taking this on and welcome aboard.
Thank you.
Commissioner Githens?
I think Commissioner Jones said it very well. Welcome, welcome.
Yeah.
Well, right now we're using the program for the facilities, and now that the fleets come into it with this upgrade, I can start integrating all our records into it. So tracking for the fleet will work really, really nicely with this. So.
Yeah, and it's great to have everything in one program and to use this software to its fullest capabilities is really, really smart. Yeah, and so we weren't too tough on you for your first commissioners meeting.
Not at all.
Next time, we'll ask a tough question.
Okay, I'll be expecting it then. Thank you, Commissioner.
Good deal. Thank you for the taking the initiative. Let's see if there's any public comment on this item. Just simply raise your hand at the bottom of the Zoom screen. Seeing none, we will come back for a vote. Mr. Cockrell, will you please call the roll on the Manager Plus Solutions LLC agreement?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Githens.
Yes.
Motion is approved, 3-0.
Great. Thank you so much.
Thank you, Commissioners.
All right. We have moved item D to the work session. So on to item E.
Move to approve ratification of ordinance 2021-10, amending the personnel policy.
Second.
Great. We have a motion and a second to Mr. Cockrell.
Yes, this will amend our personnel policy so that if an employee or a volunteer who is actively still employed or volunteering with the county dies, that employees of the county can go to their calling and funeral on the clock.
Great. Thank you so much. Something we just omitted from our previous iteration. Let's see if there are any comments, questions. Commissioner Jones?
Just the recent tragic death that we experienced is what caused us to notice that this needed to be included in the personnel policy.
Commissioner Githens?
I'm happy that we're willing to do this for employees and for the volunteers.
Yeah.
And I guess on that note, this would be effective April 1st. The change would be.
Right. That was exactly where I was going to go. Thank you. Thank you for that. Let's see if there are any comments or questions.
No?
All right. Seeing none from the public comment. None. All right. Mr. Cockrell, will you please call the roll on ratification of ordinance 2021-10, amending the personnel policy?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Githens.
Yes.
Motion is approved, 3-0.
Great. Thank you so much. Next item, please.
Move to approve resolution 2021-17 regarding private activity bond for Richland Apartments.
Second.
We have a motion and a second. Mr. Cockrell, will you please explain this to us?
Pre-pandemic, Richland Apartments had come to the county and the county council and the Economic Development Commission wanting to do an affordable housing project for senior citizens in the area. They basically want to remodel a lot of their current stock and then also add some. So it's gone through the EDC last year and this year, as well as the county council last year and this year. And it's been approved to allow them to have a private activity bond. I think for the public and your sake, there will be language all throughout it that says the county is not on the hook for a cent of the money. This is just a way so they can get a better interest rate and get some tax exemptions for their bonds.
Excellent.
And this resolution just allows Julie to sign the bulk of the documents as one person and not have the whole board sign all of it. There will be one document or maybe two that everyone will have to sign.
Okay, thank you so much. Comments, questions, Commissioner Jones?
Just that this is helping take care of a very great need in our community, and I'm very pleased that we are able to do this.
Commissioner Githens?
Yeah, it's interesting that this makes it more of a tax-free bond, which should make it more attractive to investors. So that's great.
Yeah, it's very easy to support this because on the one hand, it doesn't obligate county taxpayers, but on the other hand, what a great project. So I appreciate that they're pursuing this and making this happen. So important for our community, as Commissioner Jones pointed out. Let's see if there's any public comment on this item. Okay, seeing none, we'll come back for a vote. Mr. Cockrell, will you please call the roll on Resolution 2021-17 regarding private activity bond for Richland Apartments?
Commissioner Thomas?
Yes.
Commissioner Jones?
Yes.
Commissioner Githens?
Yes.
Motion is approved, 3-0.
Great, thank you so much. All right, we'll move on to item G, please.
Move to approve Indiana Institute on Disability and Community Agreement. Fund name, County General / Professional Services. Fund number 1000-30013-0068 in the amount of $5,000.
Second.
We have a motion and we have a second. Ms. Purdy.
Yes, good morning. I want to give a lead in and then invite Leslie and Allison to speak about this project as they are going to be heading this project up for us. This came about, it's kind of funny how everything falls into place. And when we first initiated our criminal justice study, I really don't know how we met with Leslie, but we did, and it has opened this opportunity for us. They are providing a voice to the inmates and the employees of our correctional center, and attempting to record their experiences in our facility. And this project, it's our intention that this is informational. We're gathering information to help our sheriff, our jail commander, and you guys with our facility and how we can make it better if necessary. And this is just a nice add-on to our larger study that we're currently doing. So with that, I would like to just hand this over to Allison and Leslie, because they're going to be able to tell you much more than I just did.
Okay, we will try to keep this pretty brief. And I really want to give a shout out to my research associate, Leslie Price. She actually made this connection and has done a lot of the legwork on this proposal. So again, as Angie said, this is really just to supplement the broader Monroe County criminal justice system evaluation. And so we found a validated tool to use and actually obtained direct permission from the authors. So this is a validated tool that has been used in jails to measure climate. And it looks at some concepts around relationships, safety, the facilitation of contact with the outside, the facilities, activities that they're able to engage in, and then autonomy or some of the choices that they're able to make while they are in the jail. And so we really are, I want to reiterate again that this is information for the county only. We are setting this up as a service agreement. So that means we will just be providing the survey platform. And we identified the survey and vetted that with some folks. We'll be providing the survey platform. We will analyze the data and we will be providing that as a data report back to the internal stakeholders. meaning we will not be making any evaluative or policy recommendations. This is for information only. And while we are adhering to human subjects research protocols in that we will keep this confidential, and actually they will be not identified. This is designed to be an anonymous survey and completely voluntary. So I just wanted to reiterate that it's a service agreement, and at this point it's not evaluative, or we won't be making policy recommendations. It's for you to use for your own purposes. That also means that we can't use this, we will not be generalizing this to any other jails, and we won't be reporting or presenting on this outside to internal stakeholders.
Thank you so much. Comments, questions, Commissioner Jones?
Yes, I'm excited that we're doing this, and the information really will be quite valuable for us. Is there any component to it that will help us understand how many of the people in the jail are mentally ill?
We do have some demographic questions. At this point, we haven't added anything that asks them about mental health services in the past. That is something that we could potentially ask to see if they have been identified or received mental health services in the past. Leslie, I know we've added that to some other surveys in the past. We would just want to make sure that that's something they opt to share, and that doesn't make folks identifiable. But we know that that's often the case with folks in the justice system, and that's actually how we sort of got involved in the justice system. Is my background is really in mental health, and through systems of care and work with community coalitions, we've become involved in doing some work in jails and juvenile justice. Leslie, do you want to add to that at all?
Yeah, I'll just say that if we want to add any additional questions, we just have to get permission to do so from the original survey developers, which hasn't been an issue. We've added a couple of questions based on the recommendations of folks that we've developed this with already. So, but I mean, like I said, we just have to get permission to do so.
But we definitely want to be responsive to you in gathering information that would be helpful.
Thank you. I think this would be helpful information to get. So if it's possible to include it, I would certainly appreciate it.
Yeah, that's a great point, Commissioner Jones. Commissioner Githens?
Yeah, in talking with others, it might also be beneficial to find out if some of the people who are currently incarcerated have traumatic brain injuries and substance use disorders. So, because that's sort of what we hear, but it would be actually very good to have data if it's possible. And again, I understand that this is voluntary, and so we may not get anything that it may not be the full population that responds to it, but this is a nice step forward.
And we've also been able to work with some of the county systems. Some of this available may be, some of this data or information may be available as part of their intake process, because they typically do quite a few screens as part of that process. So that's something we could work with them to assemble or gather and report as well. And that may be something that we can confirm via some of their intake processes or screens. And we wouldn't then necessarily have to ask participants, and it wouldn't need to be self-report. So that's something we can definitely look into.
Thank you.
Thank you so much. Really good, and I appreciate that you've gathered our input as well. Yeah, there's a lot, you know, and I think even given the voluntary nature of the survey, that they may choose to skip some questions as well, anybody who chooses to respond. So I think we have to bear that in mind. The other, so because of the aspect of this relating to being a human research project, it means that we can't get comparative data from other jails elsewhere, right? Because if you're not reporting ours out, then you're not going to be able to report others to us. So is there anything that you can offer us to help us provide that sort of comparative picture, whether it be just literature, if you can direct us to some secondary source somewhere, I think that would be helpful too, but I don't know if there's anything you want to say on that.
We can certainly look at the literature, and there's actually a lot of research both using this tool, and there's beginning to be more research, particularly about jails versus prisons. So we're happy to do that kind of a background for you to put some of this data in context. I will tell you that statewide in Indiana, it is very, very difficult to compare jail populations because of the way that the state collects the county data, the systems, and what they require. So we've been really trying to look at that in order to have some control groups and compare counties as well. And the only way to really do that beyond just basic demographics is to have some sort of agreement with another jail to share the data and hope that they collect it in the same way.
Right. Ms. Price, did you have anything you wanted to add on any of this?
I don't think so.
Okay. Thank you both so much for being here. We've learned a lot, and we're really excited. It does, as Ms. Purdy notes, it does dovetail nicely with the work that we're currently doing to learn more about what's going on in the criminal justice system. So we appreciate that. Let's see if there's any public comment on this item. Just click on the raise hand feature at the bottom of the screen. Seeing none, thank you again, Ms. Price and Ms. Howland, for being here. Mr. Cockrell, will you please call the roll on the Indiana Institute of Disability and Community Agreement?
Commissioner Thomas.
Yes.
Commissioner Jones.
Yes.
Commissioner Giffens.
Yes.
Motion is approved, 3-0.
Thank you, guys. And I'll be reaching out for you and the sheriff and see if we can get a time together to talk.
Yeah, I just want to thank you for your time too. And I am really honored to be a part of all of the initiatives that are going on in Monroe County. There's a lot of important work, and this meeting was really informative. So thank you so much.
Thank you.
Thank you both. All right. With that, we'll move on to item H, please.
Move to approve Bean Long SNF agreement for Steinsville Road Bridge number 12. Fund name Cumulative Cap Bridge. Fund number 1135 in the amount of $8,100.
Second.
We have a motion and a second. Ms. Ridge.
Good morning again. In 2012, we replaced Bridge 12 on Steinsville Road. During that reconstruction of the bridge, the new alignment fell within the perimeter of the historical area of Steinsville of agreement that was completed as part of the section 106 for basically design standards with federal highway requirements regarding stipulations to be met with completing the National Register of Historical Places. So the 10 years is up at the end of December. So to complete this memorandum of understanding and process the correct paperwork, we're bringing the design firm on to complete this, and it's for the amount not to exceed the $8,100.
Thank you so much. Comments, questions, Commissioner Jones?
No, I don't.
Commissioner Giffens? No. Right, thanks for following up on this. It's important work, just as important as building it, I think, but that's just me. Let's see if there's any public comment on this item. Just click on the raise hand feature at the bottom of the screen. Seeing none, Mr. Cockrell, will you please call the roll on the motion to approve beam longest NEF agreement for Steinsville Road Bridge number 12?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Giffens.
Yes.
Motion is approved, 3-0.
Thank you. And next item, please.
Move to approve ratification of NDOT Amendment Number 1 for Sample Road Phase 2 road reconstruction. Fund name, local road and street, fund number 1169, in the amount of $6,191,786.
Second.
Right, we have a motion and we have a second. Ms. Ridge.
So we had a meeting with NDOT in February going over the funding for the construction of Sample Road project. And actually they are just allocating more funds to the project to bring it to the 80-20 split. And this project will be let on May 5th.
Great, thank you so much. Comments, questions, Commissioner Jones?
It'll just be nice to get this taken care of.
Commissioner Giffens?
Yeah, I'm always just amazed at how expensive road projects are.
Not cheap, is it?
No. All right, and I don't have any other comments, questions, except to say thank you for spinning a lot of plates and organizing this and ensuring that we have received all of this funding to get these projects done on time and in some cases early. And I will note that I saw utility crews out last week when I drove through Sample Road. Not Duke, but I think it was AT&T. So
yeah, I think Smithville's been out there to relocate their lines at this time also.
All right.
And I know there's some road utility cuts and such in the area, but they will be required to repair all those when they're complete.
That's great. Thank you so much. Let's see if there's any public comment on this item. Let's click on the raise hand feature at the bottom of the screen. All right. Seeing none, Mr. Cockrell, will you please call the roll on ratification of the NDOT agreement number 1 for Sample Road Phase 2 road reconstruction?
Commissioner Thomas,
Yes.
Commissioner Jones,
Yes.
Commissioner Giffens.
Yes.
Motion is approved, 3-0.
Thank you.
All right, thank you so much. I will note that we don't have any appointments today. I do have just a few announcements. And I'll start with just a note that if you are a resident of Monroe County, you are struggling to pay for basic necessities of life like shelter and utilities, we encourage you to please contact your township trustee as soon as possible. The Board of Commissioners has worked with the Monroe County Council to provide township assistance funding to help defray some of those expenses with the economic upheaval of COVID-19 pandemic. So if you live in Monroe County, no matter where you live, city, town, or otherwise, you live in a township. So you can find that list of contact information for township trustees at the on our minutes every week. Or you may go to Monroe County's website, co.monroe.in.us, and go on to the emergency management page for that same information. To date, we have provided $80,683 in direct funding, not loans, but direct funding to 148 households in Monroe County. And we're really proud that we've been able to do that. The CARES funding for businesses and social services in the community, the program as it stands now will wrap up at the end of this month. So there is a deadline of April 30th to complete your application if you have COVID-related non-payroll expenses that have not been covered by another program. If you are in need of assistance, please go to co.monroe.in.us right in the center of the page and fill out an application as soon as possible. There's usually some questions, some details, some back and forth between the entity and our CARES administrator. And so we encourage you to complete that before the 30th in order to ensure that we get your information in a timely manner. To date, we have provided $881,265, including what was approved today. And that is direct funding, grants, not loans, to area businesses and social service entities. And we're so proud of that. And we appreciate the help of the Auditor's Office, Ms. Owens, and of course, Monroe County Council. As Mr. Shelton noted, Friday from 11 to 3, the Child Abuse Prevention Month open house at DCS. And also note that Van Buren Township is hosting an open house to have the public see their new fire station number 39, which will become part of the Monroe County Fire District. That is from 1 to 4 on Saturday. So please stop by. They're understandably proud of this this new fire station that they're opening. The address is 9039 West Hines Drive. So it'd be great to see folks out there. They will be, both events are going to be monitored and ensure social distancing. Please wear your masks and please come on out. The weather looks like it'll be really good. Anything else from my colleagues? Commissioner Jones?
No.
Commissioner Gittens?
I just wanted to talk a little bit about, we heard about the situation with the homeless in our community, and tomorrow night, I believe, is the last night that the Beacon Winter Shelter will be open. I wanted to applaud everybody who made that possible. I know that we provided some of the funding for it, but there were other people that just crowded in almost to make it happen. And so I want to thank everybody who was part of that.
Yeah, and I appreciate that. There's has been a lot of community help, and Ms. Purdy has something to add here.
Yeah, the winter shelter isn't going to be closing until May.
May, yeah.
Yeah. So I wanted to make sure that our public, no problem.
That's what I heard too, and I thought, well, okay.
Yeah,
but still appreciate everybody doing what they're doing.
Right.
So important.
Yes,
and it's good to take a pause right now and say that. And having said that, I will encourage folks to please support our team for the Solidarity Sleep Out to benefit Shalom Beacon. So please do so. All the funds raised will go to support the great work that's being done at Friends Place. So please support us. We're going to be sleeping out on April 30th. All right. With that, let's see if anyone has anything else. Don't see anything else. Commissioner Gittens, have a great vacation. Thanks for joining us. And thanks everyone. And we will have it is 11:11. And we will have our work session. We'll start at about 11:20. Does that work for everyone? Great. We'll come back at 11:20, but this regular meeting is adjourned. Thanks, everyone.